Good evening, friends. My name is Dr. Varun Shanbhag. I'm a sports physiotherapist. I'm practicing physiotherapy for the past 7 years in Andheri, Mumbai. Today we are going to talk about an important topic which is the cause of concern for all the people, those who are working 9 to 5, a sedentary job lifestyle. And that is what is causing them a lot of pain related to their postures, the working postures, which is basically back pain, neck pain, knee pain, ankle pain, headaches. The causes for them is basically rooted in your work posture and is also related to your office life. So today we are going to make some people aware about what is known as ergonomics. So in ergonomics, today's session, we will cover a brief introduction about what exactly is ergonomics, how is it relevant to the office lifestyle, and what can we do to prevent some of these pains and aches which come during the course of the work, basically neck pains and back pains. Ergonomics is a fancy word. It basically means that how you fit the job to the person rather than the conventional concept of making the person fit for the job. What that means is basically how do you make your office environment conducive so that you prevent all those problems which are going to be faced by you. So for example, your headaches, your neck pains, your back pains, they have a root cause in the way you work, the way you maintain your posture, the way you hold your body while you're working, how many hours you're working, what all should be done so that you can prevent all that. So for that, the first thing that we need to understand is what is posture. The most commonly heard word in the entire arena today is posture. What exactly do we mean by posture? Posture is basically alignment of various body parts with each other and with respect to the gravity. So how your body is held straight, how is it in lying down posture, in sitting posture, in standing posture. How is the relation of your spine? Most important part of your entire body is the spine. How your spine is in relation to your limbs, your upper body, your lower body, your neck, your back, your lower back. All those postures arranged together form one combined total posture of that individual, and that is what is called as a posture for that person. So what we need to understand is, if you can see in the figure there is a big nice posture. There are three figures that you can see. What is supposed to the posture and what are we targeting there? And that is what needs to be understood, that this is called the cervical spine, this is called the lumbar spine, and this is called as the mid spine, mid thoracic spine. So for us, the important part is most of you must have experienced pain. Like 75 to 80% of the people experience pain in these particular areas, and that's what makes this topic very important for all of them, those who are working. To give you an example of what we mean by posture and what I'm emphasizing so much on the posture, in this slide you can see that how incorrect postures caused by lifting, by sitting, by improper bending can cause you the back pain, for which you usually go to the doctors, go to orthopedics, go to physicians, go to physiotherapists to get yourself corrected and adjusted. And that's what causes it so much pain and discomfort, tingling, numbness, headaches. All those things come in together in this very same kind of an atmosphere. So whenever you have these complaints of back pain, especially let's talk about more important topic, because the entire space in which you have most of the pain is the back region, the low back region in particular. So whenever you have a lot of back pain, you go to the orthopedic, you go to the physiotherapist, you go to your general physician, and they prescribe you certain medications, certain exercises, and certain corrective actions, as they have rightly pointed out. Because once you have suffered an injury, you need to correct it. But what we are teaching today is to prevent it from coming in the first place. So preventive action will actually take a good thing. What is the advantage of preventive action over corrective action? Preventive action is actually less painful. It is easier to be done, and it causes less discomfort to the patient and increases the productive capacity for your organization as well. That's why it makes the ergonomic session makes it all the more important for you as well as the organization about how you carry your productive capacity to a good level. So as we have spoken enough about what is correct posture, what is ergonomics, and what are the common problems faced by the general population when they are working in an office environment, we also need to know what exactly do we mean by correcting the posture. What is the ideal posture in which you should be working? Because if I am telling you what you're working is wrong, there must be something which is correct and which needs to be corrected. So what exactly is this ideal posture? Now in this next slide that you see, you will see that a person is sitting on a computer, and you will see that all those components been marked out. Yes, very minutely they have been marked out, right from your heels to your position of the knee, to your angle of the back, to the way in which your forearm should be supported, the way in which your backrest of the chair should be, the height of the backrest, the height of the computer, the eye level at which your working place should be. All those things are taken into consideration before you do that. Now, in most of the cases, they may or may not be relevant or possible because every office has a different atmosphere. But what we are giving here is basically the way you should be holding yourself while you are working. What that does, it minimizes the chances by more than 50% of getting any problems or getting any pains. This office posture, this ideal office posture working on a computer is what is more important for anyone who is working in a 9 to 5 job or a 9 to 9 job, depending on how much they are stressing themselves. Because right now we are getting complaints of people as young as 25, 30, all the office working individuals getting these back pains, the neck pain, the shoulder pain, the hip pains, the pains which are not subsiding with painkillers. The reason for that is because the root cause is not painkillers, the root cause is the way you sit. This is what needs to be done. Since we have spoken enough about what is the right posture, what is the wrong posture, what is the ideal posture, what is the ergonomics that needs to be followed while you're working to prevent many problems that might be in the coming. What we need to do also is that whenever you're working for long hours, maintaining only the posture will not help. You need to constantly keep on changing your posture because holding a wrong posture for a very long period of time causes stress on that muscle which needs to be relieved, which needs to be offloaded. And that is what should be more important for you when it comes to holding your postures correct, making yourself pain-free, making yourself work better. In such cases, in the next slide you see there are certain stretches which are given. These are very gentle and general stretches which you can do it in a span of the entire set, in a span of not more than 5 minutes. So after every 1.5 to 2 hours, what you can do is you can do simple shoulder shrugs. Get off the chair, and this has been followed by offices worldwide right now because of the ergonomic awareness that these guys are experiencing, and that's what we are trying to put it here. You just get up, move around in the office atmosphere for 5 minutes, just do these stretches, simple stretches like shoulder shrugs, simple stretches like neck stretches, neck bends, back bends, twists. Just stretch out your calves, you stretch out your hamstrings. That will not take more than 5 minutes at all. And once that is done, you make sure that the pressure has never built up to a great extent. You cut off the pressure because most of the injuries that you face in an office environment are simply termed as overuse injuries. What do you mean by overuse injuries is you keep on doing a particular activity, in such cases wrong activity for a very long period of time, which causes the discomfort, which causes the pain. Now when you do these stretches for 5 minutes after every 1 to 1.5 hours, you just make sure that the overuse part doesn't reach that stage. You use it to an extent that after every 1.5 hours, you break the cycle for 5 minutes and then you go and sit back. What that does, it basically never overloads the muscle, allowing the muscle the time to relax, stretch and work efficiently, in effect not letting your pain increase to intolerable levels. For more information and appointments, you can always contact me on librate.com. Thank you.